First episode: Psychosis. Don't miss organic causes. A young patient presents to the or your clinic. They're disorganized, paranoid, hearing voices. The picture seems textbook for a primary psychiatric disorder. It's easy to see a first episode of schizophrenia. But what if it's not? Our most critical role in a first presentation of psychosis is to be a medical detective. We must rule out the mimics, the organic, the toxic, the metabolic, before we settle on a psychiatric diagnosis. Missing them can be catastrophic. So, what's on our differential? Think H's and T's, but for the brain. Start with autoimmune. Think anti-NMDA receptor encephalitis. It can present with acute psychosis, often in young women, sometimes with a subtle viral prodrome. Don't forget Hashimoto's encephalopathy or lupus cerebritis. The lumbar puncture and autoantibody panels are not just tests, they are essential diagnostics. Move to metabolic. Severe B12 deficiency, niacin deficiency, porphyria, Wilson's disease. These can all masquerade as psychosis. Then, endocrine, thyrotoxicosis, Cushing's syndrome, even profound hypoglycemia, and of course, neurologic. Temporal lobe epilepsy, complex partial seizures can present with psychotic features. A brain tumor in the limbic system, even a subdural hematoma in an elderly patient. The history is your first clue. Red flags. Listen for them. A patient over 40 with no prior psychiatric history. Rapid symptom progression. Abnormal vital signs. Fever, tachycardia. Neurological findings, even subtle ones like olfactory hallucinations, asterixis, or cognitive fluctuation. Your workup must be thorough. This isn't over-testing. It's practicing safe, definitive medicine. Basics: full CBC, CMP, thyroid panel, B12, folate. Toxicology, urine drug screen. Always consider heavy metals if indicated. Infectious, consider HIV, syphilis, Lyme serology. Neurologic, EEG to rule out non-convulsive status. Neuroimaging, an MRI is superior to CT for detecting encephalitis or temporal lobe pathology. And when indicated, lumbar puncture for CSF analysis. Autoimmune and paraneoplastic panels. Ordering these tests isn't a lack of faith in our psychiatric colleagues. It's the foundation upon which their work can safely begin. By ruling out organicity, we don't just make a diagnosis, we can reverse a disease process. We can give a patient their life back, instead of a lifelong label.